Hi, everybody. I would like to give you an update on some of the bills I had heard in committee this week. I had 9 bills heard in committee this week. I'm not going to tell you about all of them. Reach out if you have questions, but I do want to tell you about 5 of them. And I'm standing in front of my whiteboard. I will show you where they are listed, where I keep track of all my bills every week. So the first one I want to mention is around an anonymous threat reporting system. This would be a system that schools would utilize that would allow people, students, families, parents, anyone who has information on a potential threat to submit that tip and would get it to authorities, be able to route that tip through the appropriate channels. This is an excellent system that can save lives, and it would provide resources for that. More work to do there, but happy to be carrying that bill. The second bill I will name is I'm carrying a bill for the counties across the state. As you may have heard, our federal government has drastically cut the funding for the SNAP program, formerly known as food stamps. This is food support for people who need it in our communities. The feds have cut much of the funding going to that program that supplies food for folks who need it. This bill would fill in some of that gap that is now being put on the counties. We want to be sure that people have the food that they need. The third bill I will mention is a bill that is really important to me. It is around coverage, insurance coverage for kids with complex medical issues that have both medical assistance coverage and private insurance coverage. We passed a law in 2010 that said that private health insurance companies are required to cover the home nursing care that these folks need. That is no longer happening. Insurance companies are saying, oh, we don't have to do that. We're going to put a cap on the coverage that we are providing. The impacts of that are really devastating for families. These kids with complex medical needs need and deserve this care. So trying to stand up for the law that we already passed in 2010 to be sure that insurance companies are following the law. The fourth bill I will mention is related to Rochester Public Schools and our school board elections. The way we do our elections is unique. There's only 2 cities across the state who do it this way, us and Alexandria. It would just put us in line with 95% of other cities across the state. So they're not numbered, that it's sort of more of an at-large system. And the last thing I will mention is funding for Rochester Public Schools. Again, the feds are cutting money. They cut a grant program that allows staff at RPS to get social work degrees and provide mental health care for our students. Really important program. Would provide funding to backfill what the feds have taken away from us. So happy to chat more. Reach out if you have questions. Have a good day.